Hello, hello, hello. My name is SeldenSpencer. I am a physician. I want to thank the organizers for giving me the opportunity to be here today. I represent one little piece of this healthcare puzzle, and that piece is physicians. And I came here in 1990 and have been practicing here since there. And I've been in the political realm a little while, and I realize that people don't remember much of what you say unless you tell a story. So I'm going to tell you a story. When I first came here, there was a little guy that I took on in practice, and he had cerebral palsy, which means he was physically affected, maybe a little mentally affected, but his big problem was epilepsy, and that's how I got involved in his care. And he had a heck of a time, in hospital, out of hospital, in school, out of school, side effects, drugs, one way or another. Maybe by virtue of just getting a little bit older, his epilepsy got better. Maybe we found the right combination. But regardless, I was very happy when he graduated from high school. So here's a kid who had all kinds of obstacles in his life, finally got his physical problems together, graduated from high school, not only graduated from high school, got a driver's license. Not only got a driver's license, got a part-time job. And I'm thinking, well, you know, maybe the future is bright for this kid. Maybe he's going to have a family and enjoy the good life in this country and in this state. And then he disappeared. And I figured, well, okay, you got another doctor, so what? It's not a big deal. That happens. But then I get phone calls, well, he had a seizure. Well, could you refill this medicine? I guess you all know what happened to Elvis. You got to kind of stay on top of medications that you prescribe. So I finally put my foot down and said, nope, he's got to come back in. And so then we had the big dust up because he came in, he had no insurance, couldn't afford to be seen. So we arranged for some quick thing, pay me $10 and we'll move on with it, take an IOU. But it was a bitter experience because I realized that this kid who had overcome incredible obstacles in life would never have insurance. And there's three pre's that I have already been alluded to. One of which is pre-existent. I'm not talking about P's, I'm talking about pre's. If you're pre-existent, you're not going to get health insurance. If you have a chronic illness, you're not going to have health insurance. Unless you get a very cushy job somewhere. And that doesn't happen for most people. Now, then you just go bare, and I deal with this all the time. A drywaller just this last week came in, doesn't have insurance, he's a subcontractor. We are wrestling in the hospital every day. What test are we going to order? You know, how much of a bill are we going to leave this guy? As a doctor in the office, there's a second pre, which is pre-authorized, and it's a little irritating. It's not nearly as dramatic as the first pre, but I see a person, I want to get an MRI. I think it's appropriate. My nurse then spends half hour talking to somebody in Bangalore, India, making sure that the codes are right, and then I can order this test. It is inefficient. It is a useless expenditure of time. Now I'm going to venture into a little hot water because I want to say the last pre, which is prevent. And in medical care, and in this country, you know, we're basically oriented towards sick care. We're not oriented toward health care. And to the extent that all of us on the grassroots and all of us on the political level can be mindful of certain objectives that we want to achieve, perhaps we will achieve preventative care, which in the long term will be good care. And as it was already alluded to by Don, the orientation and the motivation for private insurance is to make a profit. That's appropriate. That is their job, and they should do that. Whereas the orientation for state government is to ensure we have healthy citizens. And that is our goal, and that is our objective. So as long as we keep our objectives in mind and how we achieve those objectives, I think we will achieve a cost-effective system and a system which will provide access for everyone in this state. It's no reason that this country should spend twice as much as any other industrialized country and have worse medical outcomes. There's no reason that in Iowa we spend a third of what they spend in Miami, Florida, and have better healthcare outcomes. There's much to be done, and I think, again, as Sarah was saying, Iowa is ground zero. This is a good place to work. We should be able to achieve something in the coming year. Thank you very much.